Welcome back, everyone. In today's video, we'll be diving into a critical topic that affects millions of people around the world: hospital-acquired infections. I believe it's essential to shed light on this issue to raise awareness and promote better healthcare practices. So, let's get started. Before we delve into the specifics of hospital-acquired infections, let's clarify what they are. Hospital-acquired infections, also known as nosocomial infections, are infections that patients acquire during their stay in a healthcare facility. These infections can be caused by bacteria, viruses, fungi, or other pathogens. Hospitals are supposed to be places of healing, but unfortunately, they can also be breeding grounds for infections. There are several reasons why this happens. First, hospitals tend to have a large number of patients, some of whom may have weakened immune systems or pre-existing conditions, making them more susceptible to infections. Shockingly, according to recent statistics, hospital-acquired infections affect millions of patients worldwide each year, leading to prolonged hospital stays, increased healthcare costs, and, unfortunately, even death in some cases. This emphasizes the urgency of addressing this issue. To better understand hospital-acquired infections, we need to look at the most common types. Some examples include urinary tract infections, surgical site infections, bloodstream infections, and pneumonia. Each type of infection has its own risk factors and preventive measures. Now, let's talk about how these infections spread in hospitals. Poor hand hygiene is one of the primary culprits. Healthcare providers must wash their hands thoroughly and regularly to prevent the transmission of bacteria and other pathogens. In addition to hand hygiene, contaminated medical equipment, improper sterilization practices, and inadequate ventilation systems can also contribute to the spread of infections. To gain more insights into this issue, I reached out to Dr. Smith, an infectious disease specialist, to discuss the prevention and control measures that hospitals can implement. Preventing hospital-acquired infections requires a multifaceted approach. Hospitals should prioritize infection control protocols, such as regular cleaning and disinfection of surfaces, proper waste management, and isolation of infected patients when necessary. Additionally, healthcare staff should receive proper training on infection prevention measures. So, what can you, as a patient or visitor, do to protect yourself from hospital-acquired infections? First and foremost, don't hesitate to ask healthcare providers about their hand hygiene practices. It's your right to ensure your safety. Additionally, follow any infection prevention guidelines provided by the hospital, such as hand hygiene, wearing masks if necessary, and limiting physical contact with patients. It's important to remember that hospitals are continuously working to improve their infection control measures. Many healthcare facilities have implemented innovative technologies, such as ultraviolet light disinfection systems and antimicrobial coatings, to minimize the risk of infections. To wrap up, hospital-acquired infections are a significant concern that requires attention from both healthcare providers and patients. By promoting proper hand hygiene, following infection prevention guidelines, and advocating for better practices, we can collectively reduce the occurrence of hospital-acquired infections and create safer healthcare environments. Before we conclude today's video, I want to address some important steps you can take if you suspect you have acquired an infection during your hospital stay. First, don't hesitate to communicate your concerns with the healthcare staff. They are there to assist you and ensure your well-being. Requesting a discussion with the healthcare provider in charge of your care can help address any issues or questions you may have. It's also crucial to keep track of your symptoms and any changes in your condition. Maintaining a record will help you communicate effectively with your healthcare team and assist in diagnosing and treating the infection promptly. Remember, patient advocacy is essential. If you feel your concerns are not being adequately addressed or if you require a second opinion, don't hesitate to seek assistance from patient advocacy organizations or medical professionals outside the hospital. As we wrap up today's video, I want to emphasize the importance of raising awareness about hospital-acquired infections. By sharing this knowledge and encouraging open discussions, we can drive positive change and improve healthcare practices worldwide. Thank you all for watching. If you found this video informative, please give it a thumbs up and share it with others. Together, let's work towards safer healthcare environments and reduce the occurrence of hospital-acquired infections. Until next time, stay informed, stay safe, and take care.